So I'm Todd Haskins, the chairman of the Veterans Advisory Board.
I'm Samuel Innocent, the vice chairman of the advisory board.
And I am Joe Bello. I am the secretary of the Veterans Advisory Board.
So this is our last meeting of the year. It's been a pretty historic year this year. A whole lot of legislation, a whole lot of activity, a whole lot of building, and I think, frankly, a lot more to come in 2016, which I think is going to be our main focus. For everyone's benefit, the Veterans Advisory Board has been focused on two things. The first part was really establishing and putting more of a structure in place with the change in the legislation and structure of the board. Last year, it expanded the board from 9 to 11, and you know, as a result, all the old minutes, all the old bylaws, et cetera, all have to be renewed from a board activity perspective. So we're in the process of those. And then obviously, as everybody has seen in the press and throughout, the MOVA in its current form has changed dramatically. At the beginning of the year, there were, I believe, 4 employees. Now there's 19 now. 19 now, and obviously next year, mid-year, will be the formal establishment of the Department of Veteran Services, which should come with it a lot of additional resources, funding, and likely personnel as well. All that quite a bit to be determined in detail. So I guess in terms of first order of business, with no objections, I'll move that we approve the old minutes.
A second.
Great. Okay. Thank you very much. Approved. Next one, as everyone saw last week was announced the mental health roadmap, which was a pretty comprehensive approach to the whole city. Thankfully, there was a very significant veterans tie-in, which included a number of resources, and so just as a symbolic gesture, because frankly we've really appreciated the effort that the administration has made, we'd like to commend the mayor and the first lady formally for that effort. I know the commissioner was deeply involved and obviously has a deep background in that area. So I think we on the board feel very both excited about the prospects that those resources will bring, and obviously a lot of it is yet to be figured out in terms of exactly how it's implemented, but it's a significant step up in the resources deployed on that particular topic for our veterans. So I'll introduce that motion.
I'll second it.
Okay, there we go. So through there. Next, consistent with my first comment about establishing more structure around the board for everyone's benefit. Right now, the board is 11 members, of which only 3 are present today, but many have been very active. Right now, everybody focuses on every topic. One of the things that we're going to do, and we've spent a fair bit of time working on, is presumably establish 5 committees. We'll vote on that here. We've talked about it extensively with the other board members. So we're going to have one committee on economic opportunity, a second one on legal services, one on housing, one on communications and government relations, one on healthcare. The exact structure and focus areas, we think that those 5 topics cover just about every topic can fit into one of those buckets in one way or another. And so hopefully with that, we'll be able to create a little more focus and a little more of a proactive outreach in terms of helping to advise the city on various policy initiatives on each of those. So absolutely. Economic opportunity, and inclusive in that is employment, entrepreneurship, education, things like that, basically anything that a veteran can do to better him or herself. Legal services, housing, communications and government relations, so really advising the city and MOVA on how we think they should communicate to the community and also interact with the government in the same way. And then healthcare, which includes, of course, mental health and all aspects of healthcare. So we think it's comprehensive, or hope it's comprehensive, and obviously we have the flexibility to add new committees at a later date if those prove not adequate. But with that, I'll move that we approve those committees and establish those formally, and then assign people prior to the next meeting. So next, we're going to have Commissioner Sutton's going to give a year review and basically talk through a lot of these changes, which is part of why I didn't go through them all myself, because then it'd be a little duplicative. So, Commissioner Sutton?
I really can't commend you enough for the leadership that you've shown in bringing the new VAB members together. This is a very historic time on so many levels. When I came on board a little over a year ago, in September of 2014. The VAB at that time, led by Vince McGowan. Let me just say, Vince, thank you for your leadership and your willingness to, be available as a consultant, as the historical continuity, the bridge between the VAB up until the time that it's been renewed or reappointed, which is just really exciting with the legislation over this past year that brings to us a greater level of transparency, hence the filming here in the background. It gives us a greater degree of outreach and presence. There will be a minimum of one VAB meeting in each of the boroughs. And let me just say, Staten Island, you've got it going on. I mean, this is a great turnout. Let me just give yourselves a round of applause. As you can see, just from the actions just in these last 5 minutes, to have a secretary taking notes, capturing this. I know that we've got an end-of-year report coming up, the resolution in terms of the First Lady's strategy roadmap, as well as now the committees. This is just the beginning, but it's truly a privilege and a pleasure to work with the Veterans Advisory Board. And of course, anyone who has ever been on the Veterans Advisory Board, we maintain contact, and we want to make sure that that bridge of wisdom, of continuity, of history really is honored. Because for any of us, you think about it, we served in uniform in whatever service, Army, Navy, Air Force, Marine Corps, Coast Guard, whatever service we served in, we served at a given point in time. We were part of that current of history, of our nation's history. And some of us here, anybody here a family member? Family member of a veteran? We've got one here, we've got one here, we got several here. I want to just be able to recognize as well, family members serve as well. And of course, there are those who serve dual duty, both in uniform and as family members. So it's a matter of great pride and privilege that we're here tonight, the first Veterans Advisory Board meeting. I just wanted to, as Todd said, I just want to spend a couple of minutes very quickly reviewing this last year. And then any questions that you might have, I'd be glad to address them. Last year, came out of the gate with a listening tour, visited every borough, came here to Staten Island, both to the Staff Sergeant Michael Ollis, VFW Hall, came here to the art exhibit, just recently the Michael Ollis statue in the schoolyard where he went to. I mean, just things that go on here at Staten Island. Of course, I've had the experience to go to all of the boroughs and talk with as many people, as many organizations, and more importantly than talking is listening and learning. Well, what came out of those experiences, and there were several hundred during those first 90 days, and that's been just the ongoing initiation of what's become an extended dialogue and in many cases partnerships. But there were 3 strategic key priorities that emerged from that initial listening tour. The first, you may have heard the mayor in his State of the City address, where he pledged to end veteran homelessness, joining several hundred other mayors and cities across the country, joining the White House, joining the VA, HUD, all relevant agencies of government, and that's something that we're working very hard on right now, and we're making great progress. And in January we'll have a chance next meeting, or February, to be able to review in detail for the VAB where we are at that point. Second key strategic priority is to team up with the First Lady and her mental health roadmap strategy. It was almost a year ago now, I think it was in January, when she first publicly stated that this was going to be her strategic priority. And as I listened to her talk about the fact that she was viewing this challenge from a public health perspective, looking at things that communities need, looking at where health and healing starts, which is not just in a clinic room or a hospital, as important as clinical care is, but to really focus forward on communities, on empowering individuals, families, peer-to-peer interventions, and to make it easier to access quality mental health services, both in non-clinical settings as well as clinical settings. So I knew immediately that this was an approach that so clearly fit in with what our veterans and their families respond best to. You know, when Lee Cavina was a private and you know, came into the service, you know, for whatever else had been part of your background, Lee, from that point forward, it was all about the team. It was about mission. It was about responsibility, about honor, about sacrifice, right? And, you know, so to think that the first place that a veteran who may be having some struggles coming back from deployments, or maybe they served during a peacetime era, or maybe they were served in a wartime era but weren't deployed. But the point is that he or she, in this case Lee, you know, raised your hand and said, "Here I am, send me." And so coming back, the first point of hope, health, and healing ought to be on the front lines of community and not in a clinic or a hospital bed. Unless, of course, that's something that someone needs right away. Some people will need clinical care right away, but most folks will really restore the capacity for safe and trusting relationships with their families, with their peers, in the community, around the water cooler, if they're still deployed in the foxhole, the kitchen table. So it's important, I think, to understand the framework the First Lady has set up. She has been on a listening tour all through the city. She has consulted far and wide to bring the best of what's going on across the nation here to New York City. And I would encourage you, you know, if you just Google NYC Thrive, or Thrive NYC, you'll see some just really great graphics that show in very poignant detail what the areas of focus. There are 6 principles and some of the new initiatives, which in case of veterans, I'll just give you a quick rundown of the 4 that are related specifically to veterans. What they have to do with, first of all, we're working with 311, the city's 311 system, to be able to directly connect on all the platforms to the Veteran Crisis Line. That's the national crisis line, and we know that's the crisis line that was featured in the movie, what was it, Press One?
Press One.
Press One, that won the Academy Award. We're very excited about that, and we're working to really help improve the ability for veterans and their families to access the Veteran Crisis Line. We're also very excited about a public education campaign that will be part of the roadmap, that will be, you know, incorporating veterans and their families into that public education campaign so that we can reduce stigma and help make it no more unusual for someone to go get, you know, help for a mental health issue as they would if you broke your leg and, you know, needed to go in and, you know, get surgery, for example. You don't see it right now, but Todd has just recently come from surgery, so we'll just pick on him for a moment. But, you know, there ought to be no more big a deal than to get help for a broken leg. So that's the public health education campaign. Then also, some of you remember, we got some funding in June to be able to branch out to build capacity with veteran outreach specialists in all of the boroughs. Well, we're going to be able to double down on that capacity. So we'll be able to have a pair of folks who are working together in each of the boroughs. They'll have a primary borough, a secondary borough, be able to provide cross coverage. About half of their time will be out in the field, half of their time will be back at the central office, being able to keep issues and initiatives and policy and programs moving forward. So we're very excited about that. And then we are also, let me just think for a moment, there's 311. Yes, very important that there is a fund that will be available for holistic and integrative approaches. Things like yoga, things like acupuncture, things like equine therapy, service dog therapy, things that we know the veterans and their families really resonate with. Helps them feel normal, helps them get their mind-body systems back in balance, and then if they need clinical care, they're not alone. So we'll be putting more guidance out on that shortly in the new year in terms of how we'll proceed. But that's very exciting. Other things during this last year, our third strategic priority has to do with jobs. Catherine Laporte is going to be talking about that. How can we better link veterans and their families with city employment and career opportunities and resources and services? So you'll hear more about that from her. It's very exciting. And certainly you'll hear a lot more about that in the new year. But other things that we did besides bringing on board both the speaker and the mayor working to refresh and renew the Veterans Advisory Board. We also launched the Veteran Designator for the new IDNYC program. How many of you folks have an IDNYC card? Great, I see several of you here. Listen, I will tell you, run, don't walk. Go get your Veteran Designator IDNYC card. And whether or not you're a veteran, tell folks that, your families, tell your friends. The IDNYC card is fantastic on its own. You get a year's free membership to over 30 cultural institutions, the great museums here in New York City. What you get on top of that with the veterans designation, you're going to hear more about from, is it Luke?
Yes.
Luke's going to talk about that a little bit later this evening. You'll hear more of those details. But then, of course, from day one, we said Bo was on the move. Well, then in August, September, we actually did move. So we're now over at 1 Center Street, the David N. Dinkins Municipal Building. In the new year, we'll have an open house reception. And then, of course, most recently is the news about MOVA transitioning in the new year to become a Department of Veteran Services. I don't have details on any of that right now because there's going to be, of course, a detailed planning and transitional process, but I can tell you that we're all very excited. This is a moment in history that won't come our way again, and so we've just got to all band together. Veterans of every era, every service, every component, active, reserve, National Guard, family members, reserves, National Guardsmen and women, and just really make this count. So let me just stop there and see if there are any comments or questions. Yes, Lee.
Will any of this new staff coming in or any of the existing staff be certified to do VA claims?
Oh, thank you so much. The Veteran Outreach Specialist, all of them will be certified to do VA outreach claims, absolutely. And we're working with the state now. There we are, great. Nice to have you here with us today, thank you. We're absolutely going to provide that training. In fact, Catherine Laporte can talk more about that in detail, but she's working on the getting that all lined up so that they'll all be certified.
I have one other part to that. Will they also be trained to do discharge upgrading? Because from what I found out, there are at least 400 cases with the Justice Center right now, and we have a lot of people being discharged out. The military is declaring certain individuals with PSD as bad discharge. These people cannot get services without good discharge. So it's just like the Vietnam era when they threw us all out after the draft. We need people that are capable to do discharge upgrading. They used to have traveling panels to go before.
Okay, I'll tell you, I don't have any.
It's a specialty that a counselor needs to know. I don't have many.
I don't have any details on that right now. I will tell you that I know that, for example, the DoD right now is just responding to a congressional requirement to do a full review on discharges, so we'll be watching that carefully, but we're not going to wait for the results of that. We'll be working with the Urban Justice Center and other legal services here in town and make sure that anyone who needs a discharge upgrade gets access to the legal services that will absolutely get them in that track.
I was shocked to find out their caseload is 400 discharge upgrades as of now, and we haven't even had the full run of people coming out.
There is a lot of work to do, absolutely. Thanks, Lee. Yes?
In regards to veterans getting access to proper mental health treatment, now, as everyone's aware, the big requirement, the big thing is making sure people have adequate health insurance. Now, not everyone has a job where they get health care coverage, and since the VA has been lacking, I'm sure a lot of people can. What will MOVA and the department do to actually make sure that more veterans who need that mental health treatment get access to it?
Well, I would say, is Letitia in here right now? She may be out. She may be out in the. Some of you know Letitia. Letitia is one of our certified veteran benefits counselors. She and Inez and our outreach specialists will absolutely work with anyone who's having difficulty accessing care. I will tell you that we have some wonderful services here in this city with respect to mental health. And if you know of anyone who needs, for example, today, free, no hassle mental health care, and for whatever reason, either they're not eligible at this point for VA care, or for whatever reason they prefer to seek care elsewhere, NYU has a wonderful military family clinic. Also, Weill Cornell Medical College has free, the Headstrong Project has some wonderful services that are available. For a combat veteran, the vet centers are storefront. We have 6 of them in New York City. And of course, if the difficulty that one's seeking help for has to do with combat trauma or military sexual trauma, families are authorized to come into the vet centers. So you'll hear more about that, but if you have any questions about the mental health services that are available here in New York City, please contact our office. We'll be glad to work with you or anyone else that you know of who might benefit. Thank you for that question. Very important question. Any other questions at this point? With that, I'll turn it back over to Chairman Haskins.
Thank you. I think now we're going to hear from Deputy Commissioner.
As the Commissioner indicated, that MOVA is certainly on the move, and it's a pleasure to just be here in this moment in time as a veteran and certainly as a New Yorker. I would like to just ask very quickly for our new outreach coordinators and Letitia Rousseau, who the Commissioner talked about, just to come up front just for a second.
Front and center, double time. Here we go, here we go. Hey, what do you think, Cedric?
Know when they call the office who they're talking to. We have Letitia Rousseau here. Just introduce yourself really.
Hi, I'm Letitia Rousseau. I'm the military liaison for the Mayor's Office of Veteran Affairs.
And I'm Ashmat Akkad. I am a community outreach for MOVA as well.
And I'm Dayanita Rios, and I'm also called Veteran Outreach for MOVA.
Okay, so you met, Letitia's been here for years. I won't date her with her age, but that means that she's very experienced, and as the Commissioner mentioned, she is certified, so she's a certified benefit counselor. And then our other 2 outreach coordinators are part of the new hires that we're doing. In total, we have 6 new hires, and they are 2 of them, and they come with them ready to go on day 1. They've been doing reintegration work, and we're just really thrilled and very happy to have them all on board. So thank you so much. I just would like to just really take a moment just to say thank you as well. Wonderful turnout. You know, we've been going out to the boroughs. It's a new legislation this year. We've had, some challenges depending on the borough, and we're working through that and looking forward to next year being bigger and greater. But just, the Staten Island Advance, the College of Staten Island, we have CUNY, Lisa in the back, our advocates, of course the MOVA outreach staff, and our very own Charlie Grinsky, who's a board member here, who took a little fall earlier today, so he's not here. But we really thank you all for helping us with the outreach, and certainly all of you and word of mouth always helps. So we want you to continue that as we move on. A little bit about our job outreach that's been underway. If you haven't heard, come closer. New York City is hiring, and we're hiring veterans. So if you know anyone who's looking for a job, please ask them you can hop online to nyc.gov/jobs and find jobs available. And I would encourage you to share with our fellow veterans, when you submit an application, be sure to put right up front that you're a veteran. If you're a spouse, right up front that you're a spouse. Or if you were a child of a veteran. All of those things help us identify and to be able to help even more. We also are working with our military services locally, here regionally, to get into the cycle of our fellow veterans prior to discharge. All of the services have, and the program name changes, whether it's TAP in the Army, but they have classes prior to discharge that they all are attending, and what the military is finding is that these classes are being taught by other folks who were in the military. And so The military knows that they've got a lot of work to do. They want to do this work, and MOVA is here, and soon to be the Department of Veteran Services is here to assist with that. And that's the work that our outreach coordinators are doing. Right now, they are getting trained up in various areas through HRA, through Consumer Affairs, all of the various questions that require answers. So you haven't seen them out in the community, and that's the reason why. So if you have any recommendations, I mean, we're going to be working, who's here from the state? I heard you mention earlier. Oh, great, great, great. They will be getting training through the state and Veterans Affairs, and we're happy also to share with you that we will have DAV embedded with us at MOVA, as well as the VA Outreach Coordinator will be embedded with MOVA as well. We also want to bring to your attention, for any homeowners, you can be sure to jump online to nyc.gov, to the Department of Finance page, but I want to bring to your attention that the deadline for your tax exemption is March 15th. We have some of these forms for your convenience right up front, so be sure to pick that up. And Workforce One, getting back to jobs. We're very fortunate that we have a Workforce One center very close to Borough Hall here, and just a hop, skip, and a jump from the ferry at 120 Stuyvesant Place. So be sure to take advantage of the Workforce One Center. They have specific veteran coordinators that are located there, and so we want you to spread the word. Just like MOVA is on the move, Workforce One is on the move, and we're working very closely with them and our sister agencies throughout the city, throughout city government, to provide better service for you. And speaking of that, and the commissioner talked a little bit about ID NYC.
Thank you, Commissioner. Deputy Commissioner. Good evening, everyone. My name is Luke Hayes. I'm the field director for the IDNYC outreach program. Has everyone heard of IDNYC? I know we've got a couple hands go up with their card. Fantastic. It's this brand new program that New York rolled out earlier this year, and it comes with a variety of benefits that we're really trying to spread the word. It's really kind of a pass to New York. The two requirements are that you're 14 or older and that you live in one of the 5 boroughs of New York. Other than that, you can apply for the card at any one of our enrollment locations. We actually have one here in Staten Island over at St. Mark's, and we had a pop-up location over at the New Dorp Library just a few weeks ago. So we're trying to get out and about across the city to make it easy to access. A couple of great things about the card for anyone. You get access to 33 museums and cultural institutions like Museum of Natural History, BAM, Bronx Zoo. Just all across the city, all the boroughs have some really great sites to see. Free 1-year membership at these sites. In addition to that, you also get discounted movie theater tickets. So if you got a family or it's a rainy day, you can get movie theater tickets for $8 at AMC, Regal, and some other locations. There's also discounts to Broadway shows, Yankee tickets, and a variety of other entertainment discounts. Also, if you go to the YMCA or use Parks and Recreation, you can get discounts for clubs and activities there. And for veterans, we have a specific veterans designate where you can get a veterans designate on your card, indicating that you are a veteran. All you need to do is bring in the documents for regular application, as well as proof of that you are a service member, either active or retired. I want to say DD-214 and DD-2. D2, am I correct? Okay, sorry. Still learning the
There's another form for
forms.
reservists,
Yes.
but they know.
Okay, cool. I'm still trying to commit that to memory. But with this Veterans Benefit Card, you also get free membership to the Intrepid Museum, as well as access to Veterans Advantage and many discounts there. It's not free, but a lot of times you get upwards of 20 to 30% off at a variety of locations that Veterans Advantage is in partnership with. And we hope all of you take advantage of this card. We're really happy with the growth. Right now we have over 500,000 New Yorkers have signed up for this card. So we're encouraged by that, but we really want to make sure that everyone that can apply for it does get it. And especially for the veteran community, we want to make sure that you are recognized for your service and really take advantage of some of these special offers for the veteran community.
Important to note that this program, just in its first few months, has enrolled more New Yorkers than all of the other cities who had done this program over the last, I think, 6-7 years combined. And when it comes to veterans, this is the first city that has a veteran designation on its municipal ID card. So it's your chance to make history, and as Luke told you, it's just a great, great program. So don't hesitate, run, don't walk. Get your ID card with your veteran designated.
We have information on the table outside, and the outreach team is already up to speed on all the benefits that come with the card. So please feel free to ask us about it, and we'll try to get you set up for an appointment. Thank you so much for your time.
Perfect, thank you.
And then just in closing on our portion here, just want to thank the Veteran Advisory Board for all of the great work that you've done throughout the year. We're really looking forward to next year. And we'd like to thank the Borough President of Staten Island for hosting us this year.
Okay, for the last portion of the session today, now we get the opportunity to hear from you. So we have a number of folks, 1, 2, 3, 4 people who've signed up with an offering and asking to make public commentary. We use this as an opportunity to get ideas. A lot of the different ideas and policy initiatives that have been brought forth have actually started, with an idea from someone within the community. So we really rely on these. Normally, one of the representatives from the borough will host this session, but as Charlie unfortunately is out today, Samuel will do the honors for the evening.
I'd be glad to be an honorary Staten Islander for the day, or for the very least the next few hours. First up, we have to speak. Who signed up to speak first? I'm sorry. First name Michelle, last name Payton.
They're closing systematically the Brooklyn VA. I do not want to go to Manhattan. I went to Manhattan, and in the middle of procedure, I woke up and I didn't get any more anesthesia. So I never go there again. My father went to East Orange, and it's just too far for me. It's too far. They hired new people to conduct surgery, but you have nowhere to put the people after the surgery. I have multi-health problems. I'm on dialysis. I need to be, if something goes wrong, which a couple of times with my heart and stuff like that, things have gone wrong, I need to be in the Brooklyn VA where my kids can get to me. And I just want to know, when is somebody going to help us keep that place open? It's slated to be, we're not supposed to know this, but it's slated to be an outpatient clinic. And I don't understand this. They put state-of-the-art stuff in there for an outpatient clinic, and they're closing down floors. And more people are going to go out to the private sector because nobody really wants to go to Manhattan. It's crazy. So, I don't know, how can you help us? I mean, I was on a picket line earlier this year with the nurses, and I just want to know, we lobbied everybody, and it seemed like it's being closed, and it's being closed because she wants to save money. But when a director wants to save money, she doesn't fire anybody that's on the staff that's up there. Nobody's getting moved. And it just seems like very vicious. And what do we do? I don't know. What do we do? Yeah.
So a little back history on that. PricewaterhouseCoopers had done a study not too long ago about the VA services in New York City, and they had made certain recommendations. What seems to be happening now is that the VA is now following up on these recommendations, which is closures of certain parts of hospitals in order to save money and make the VA overall more cost efficient. And it's up to us as residents and people who use the VA actively to kind of say our part and speak up as far as why we need these services. And even though they may not be as frequent as the VA would like, doesn't mean that they're not necessary, right? Doesn't mean that they should get cut. A part of this process is actually speaking to your council members and your legislators to kind of have them speak up and step in on behalf as elected officials to lobby the VA and which is essentially the part of the picture of the federal government, to not shut down these wings and to find different ways of saving costs. Now, there are certain initiatives that the VA has taken on to hear from the public. My VA is one that was brought up today, actually, in the executive session earlier, as far as hearing from the community and what we should do. So now, if you haven't been, you may not have been following what's going on with the VA in LA. There was VA property in LA, got shut down a long time ago, and the VA was slated to sell that property and or lease it out and make a lot of money off of it. Veterans spoke up, and now that plan has changed. They did a huge national survey as far as what would veterans like to see become of that space and that land, and now they're beginning to follow up on that. So I believe that the same thing can happen in New York, but it's up to us as a community to come together and make that known. Cedric Smith. Cedric, my apologies.
It's okay. Good evening, everyone.
Good evening.
My name is Cedric Smith. I'm an outreach specialist at Black Veterans for Social Justice in Brooklyn, New York. I'm here with 3 of my colleagues, Mr. Baker, Mr. Rogers, please stand, and one of the directors of our HBRP programs, Mr. Smith, as well. No, we're not there. I'm glad, Miss, that you brought that information up about the VA hospitals. And we know before, when they tried to close the Manhattan and Bronx VA, the veterans had to come out and rally. And this information needs to be sent straight out on the net so that veterans can come out and rally. Because if we let the VA hospitals close down, the regular hospitals cannot handle the type of conditions and issues that veterans are facing. And that's going to create chaos within itself. I'm here to speak, though, about my very serious concern concerning affordable housing as opposed to income-based housing for veterans. Affordable housing does not allow veterans who are not in a certain income bracket to get housed. And yet we come home from active duty service, reserves, National Guards. We face a multitude of financial, physical, and mental health problems that are not being addressed readily. I used to sit on the New York State Council for Veterans Organizations in Albany. And that part, which you know, Mr. Bello, is where the state and federal legislation gets rallied against to do things for veterans. If we don't use our political realms, as you mentioned, to push for changes for veterans here in the city, as well as nationally, we're going to be fighting each other for a crumb of bread. And that's what I'm looking at in the future. One of my outreach activities does not only consist of the 5 boroughs, but I do Long Island as well. And it is sad to see how many homeless families, including veterans, are living in the woods. If you think the subways is bad, try living out there during storms, during the wintertime. And they're surviving. Some have been out there 22 years, unknown. Some have been found frozen to death in the woods. But Long Island took a step further, and they created a housing complex for veterans called the Veterans Village. And I want to pass this around. So the advisory board, if you go through that way. This housing committee, this village was created for a lot of the homeless veterans that they found on Long Island. And that's who are living in this village. It's not only affordable, it's income-based. They have their own power unit, which is solar powered. Their community is kept clean. You won't find a speck of paper on the ground in this village. And it's located in Amityville, off of Albany Avenue in Long Island. I was a homeless veteran when I came home with my family. And it was a hard struggle for me to get on my feet. It made my PTSD, physical conditions, stressed me out, depressed me. So even once I went into the VA hospital in the Bronx, just for a simple nose operation and flatline on the table. But I'm here today to tell you that I have been committed for almost 15 years of helping homeless veterans and their families, as well as other homeless people out here on the street. If we can come up with some solution, besides building a golf course by the Whitestone Bridge in the Bronx, that could have been a veterans housing community. Because I haven't seen anybody win anything, let alone seen them play over there. But if we as veterans who have put our hands up and say we are willing to die for the countless faceless people on this planet, we deserve more than just a thank you for serving. We should not have to suffer and die on the streets, shelters, or anywhere else alone. So I'm appealing to you as veterans to step up as leaders that you were taught to be in the military. Let your voices be heard. Let your penmanship be heard and seen. As they would say in the military, stand up and be recognized. Because what's coming down the pipe is not something that you really want to stomach in the veterans or the New York City 5-borough area. Thank you.
I appreciate your comments very much, and I know we've had the benefit of a lot of additional information around the effort to try and stop veteran homelessness, get to functional zero, whatever term you want to apply to this. And right now, the limiting factor, we've identified the vast majority of the veterans who are in a homeless state, at least that we can identify. If you know of any others, please let us know. But right now, we have a problem of placing them, finding available housing. And so that is
if it was income-based, you wouldn't have a problem.
Yeah.
But because there are guidelines and stipulations to qualify them for certain programs, even the HUD-VASH, it makes it very difficult for veterans in need, even the ones that have families, have housing, struggling to stay into that housing when they can't afford to do so.
Yeah, so I very much agree that that's an area that we all need to focus on and need help with.
So on that note, if anyone knows of any landlords who would like to have apartments rented out by veterans who would receive income subsidies to be able to afford rent, please pass that information along. It's vital to the cause and to the overall mission of helping house our veterans.
Yeah, and Mr. Vice Chair, Mr. Chairman, we also have, MOVA has hired 6 peer-to-peer coordinators who are working directly with veterans. I'd be happy, sir, to talk with you a little bit more after that, at the end as well.
Also, I failed to mention that the organization has 3 homeless veteran programs. One's exclusively for female veterans and their children. We have employment services. We have an SSVF program, which is a preventive services for veterans to keep them in their housing if they're facing homeless conditions, and to help them get into housing, those that we find in the shelters and on the streets. So this organization has been around almost 40 years, incepted by Vietnam veterans, Joe Mazzariki, and the board of his committee, and it's still standing, trying to service the veteran community in the 5 boroughs, not just Brooklyn, within the 5 boroughs. And last year, we reached out to Long Island. But we're just few. We need the many to come on to make the difference.
Thank you, Cedric.
You're welcome.
Up next, we have Mr. William Smith.
A lot of Smiths on board tonight.
As board members, veterans, I just want to say good evening, and pretty much I'm from the same organization as Mr. Smith. And he said a mouthful. He said some of the things that I'm going to touch on, but I'm just going to go a little detail. We do have jobs. We do have programs to house the homeless. We have one of the best rehousing divisions in the city. Our goal is the veterans homeless, if we find them either in a shelter or either staying with a family member, we want to rehouse them within 90 days. It starts with pretty much temporary transitional housing. From there, it could be a room, it could be an organization like MAGB in Brooklyn. From there, we see what the income base is. We also have a huge budget that we will pay the veterans rent for a few months. And if they're in their arrears, we will assist. And then our employment division comes in to help the veteran find a job so they can sustain themselves. With that being said, also, our primary goal tonight is to reach out to the homeless veterans in Staten Island. We've just recently inherited Staten Island as a catchment area. We've been serving in Brooklyn, Bronx, Queens, and Harlem for the last couple of years. As of July 1st, Staten Island is our new area. With that being said, we need your help to find the homeless veterans in Staten Island to provide the services. So I'm here with my outreach specialist, with another program manager. We need to find out where the veterans are. I've been out here a few times myself doing outreach, and for some reason, there's not that many shelters out here. There's not that many homeless divisions. I've worked with the Veterans Center. I've worked with Project Hospitality. And in the last 3 months, I think I maybe got maybe 5 veterans. So with that being said, I need the people that are here on Staten Island to pretty much reach out to my organization, provide the veterans to us so we can get them off the streets.
Can you tell us how they would reach your organization if they needed to? Website?
Absolutely. Thank you very much. Okay, we have literature, we have cards, and I definitely would like to get your card and share my information with you. Guys, anytime that you have a veteran, you can simply call. We have an outreach team that if a veteran is homeless, we will come pick that veteran up, bring them to our office, assess them, and make sure that they are housed. So that information will be left today. We'll leave literature in the front, and we also will share our business cards and our contact information as well.
That's great.
Thank you.
Thank you.
Next up on our speaker list, we have Mr. Lee Convino.
I'm the former vice chairman of the VAB, and I served there for 13 years. Currently, I'm the treasurer of the United Staten Island Veterans Organization, which sponsors the annual Memorial Day Parade and other veteran activities here on Staten Island. I'm here to talk about the Veterans Real Estate Tax Exemption and a new law that was passed that we are being blocked from taking advantage of in the 5 boroughs. That new law is called the Veterans School Tax Exemption. And if you get statements, as I just got last week, on your tax exemption, look where it says school tax rate. Mine says 11.58%. Pretty high number. That school tax rate has gone up over the years. When it first started happening, it was single digits. Every year it went up. As that rate goes up, your exemption goes down, and you get less of an exemption. So the state of New York, because it was happening to all veterans in New York State, passed a law signed by the governor in the fall of 2013. That law was called the Veterans School Tax Exemption. And as a member of the VAB, I began to advocate with the city council to opt in to the law, because when the state passes a law, the city, which is a municipality, has to opt in order for their residents to benefit. The council told me something very strange. They said, the wording of the law is such that we can't opt in. The law didn't say populations over 1 million people, which typically mean municipalities like New York. So I went to our state legislature and I said to them, the city says we can't opt in because you have the wrong language. Can you pass something or amend the law? Oh no, we don't have to amend the law because the way it's written, the city can opt in. So we have both entities saying opposite things. I asked for a legal definition from the state legal counsel saying that the city can opt in. They didn't provide it. I asked the city council to go to their legal counsel to provide a letter saying the city cannot opt in. They wouldn't provide something in writing to me. So we have nothing in writing, and we have thousands of veterans, many who are on fixed incomes, which ever since I retired a year and a half ago, I can proudly say I'm one. And that fixed income's going down every time the school tax goes up. So I guess what I have to ask, I brought this up to the Veterans Advisory Board in September of last year, but it was a transitional period. The new commissioner was just coming in. The old board, which included myself, were completing their terms, and it might have fell by the wayside. But I would like, once again, to ask the VAB and anybody who's an advocate in this town that wants to help veterans who own housing in all the boroughs to help resolve this. And I think the easiest way would be to get legal counsel of the mayor to make a determination that we can't opt in. You can bring that to the state reps and tell them to amend the law. If it's not true that we can in fact opt in, then we need to push to opt in. This isn't going to happen overnight. But in the meantime, that 11.5%, I guarantee it ain't going down next year. So anything you guys can do, if you want to reach out to me, VAB knows how to reach me, and I appreciate your time. Thank you.
Thank you.
We're going to try and plan out all the meetings for the entire year and get that out to the community so that everybody knows kind of well in advance and can plan around that and hopefully increase attendance. Although frankly, thank you Staten Island, because this is tremendous attendance, so we appreciate that.
And we'll be back.
So, we'll be back.
I'm looking forward to seeing you all again when we come back here to Staten Island.
So with that, happy holidays. We'll adjourn until the new year.
Thank you.